Okay, great. Welcome back from coffee and cake. Hope everyone is suitably caffeinated and refreshed. On a glorious spring Friday day in London, we're going to talk now about health and a changing environment. We've got a fantastic session coming up. My name is Charlie Lees. I'm Professor of Gastroenterology at the University of Edinburgh. And my co-chair today is Dr. Zara Razi-Estabra, who is now Senior Lecturer and Consultant in Cardiology at the Barts and Queen Mary's here in London. So we're going to have, first of all, a plenary on health, climate change and air quality, 2 oral presentations, and then a second plenary on what to expect in a changing climate. So I'm going to hand over to Zara to introduce the first speaker.
Thank you. It's a huge pleasure to have with us as our first speaker, Professor Frank Kelly. He holds the inaugural Humphrey Battcock Chair in Community Health and Policy at Imperial College and is Director of the Environmental Research Group. He provides policy support to the World Health Organization and is a member of the Health Effects Institute Review Committee on the medical effects of air pollution. And we're delighted to have him here today to talk about climate change and air quality changes ahead.
Thank you very much and good morning everyone. And thank you to the Association for the invitation to talk today. As you can see, the title, Health, Climate Change and Air Quality Challenges Ahead. Hopefully I'll be able to cover all of those in the next few minutes. So, first of all, air pollution, it's a worldwide problem. It doesn't matter which country you go to, you're going to experience air pollution problems. Even here in the UK, we have 99% of the population who don't breathe air of the quality indicated by the WHO guidelines. So, in the last Global Burden of Disease report in 2024, it was indicated that there are 7 million premature deaths across the world due to breathing poor air quality. And this manifests itself not through just air pollution alone, but through a contribution to the major diseases which we know today, such as stroke, cardiovascular disease, and various cancers. And of course, in the UK here, we have relatively good air, not good enough air, but we have relatively good air. But there are major issues in other areas of the world, such as Southeast Asia and Africa, where there are millions of people suffering, simply due to the quality of the air that they have to breathe. Now, there are multiple sources of air pollution. The most obvious ones are traffic in urban areas and the generation of electricity, both of which, of course, are burning fossil fuels. But there are other sources such as chemical industries, the urban environment, just generally home heating, etc., and cooking of various forms. All of these involve combustion. So it's the burning of fossil fuels which leads to the generation of pollution. So really, climate change and air quality, they're the same two sides, the two sides of the same coin. So it's really this use of fossil fuels which is driving both these issues. So that's the connection between climate change and air pollution. It's the fossil fuel use, which of course we're trying to mitigate. So, how is climate change affecting the air that we breathe going forward in a changing environment? Well, it's doing so in a number of ways. In some regions, there's an increased risk of severe fires, as we've just seen in LA in the last, at the end of 2024. Terrible, terrible fires happening on the outskirts of major urban areas where people are actually having to breathe in the pollution, the particles and the gases which arise from these events. And of course, you've seen the headlines across the world. This is happening on a more regular basis, and it's happening in much bigger, more severe conditions. And the pollution which generated by severe fires is now being shown to have a range of health effects, such as this increase in child mortality in low and middle income countries. A second issue, which is beginning to have more impact in certain areas of the world, is desert dust. Now, we know desert dust in itself is relatively inert initially. I mean, it does cause irritation, of course, to the airways. But a lot of this desert dust is beginning to travel very long distances. And as it moves through different environments, it's picking up various chemical signatures, and it's picking up various biological signatures, such as we have a city now, Beijing, which has actually had big improvements in air quality over the last 15 years because the Chinese government has had major push in improving air quality, but now they're actually suffering on a regular basis Mongolian dust storms. And this is really setting them back in a number of ways, which is much, much more difficult, of course, to manage. And the mechanisms, as I said, which drives the injurious nature of desert dust is this chemical signature which they're picking up and the biologics which they're picking up. A second way in which climate change is affecting the air we breathe is a third way is through the increased generation of ozone. Now, ozone is a very toxic gas. It's very, very damaging to our airways, but it's a secondary pollutant. It's not a primary pollutant. It's generated by the action of UV radiation on other pollutants such as VOC, volatile organic compounds. So as the areas in our cities heat up and we've got more sunlight, then we're going to see more ozone being generated. And of course, back in, I think it was 2008, the Royal Society highlighted this issue about ground level ozone increasing. And the conclusion from this report was by the end of the century, it's projected that the hot summers such as those experienced in the Northern Hemisphere in 2003, and if you remember that was a particularly bad year, and heat waves such as those experienced across Europe will become more frequent with an increase in the frequency and the magnitude of such events. Mortality and morbidity will also expected to increase. And this again, we're beginning to see this happening in many urban areas. And of course, there's a big social injustice issue to all of this because green spaces and heat island risk are not distributed equally across many urban areas. And as we see more increased temperatures, we're going to see more increased ozone, and that's going to be in areas where we've never really had a problem with it before. The fourth way in which climate change is going to be impacting our health potentially is through increased pollen allergenicity. So we're going to see an increase in the pollen season, so earlier development of the season and it lasting longer. And the pollen itself, some of the pollen is having an increased allergenicity. So this report from Climate Central suggests that the more CO2 we have in the atmosphere, it means that bigger plants. So we're going to have more potent poison ivy, for example. And you can see here that the poison ivy oils have nearly increased threefold since the 1950s, and they're projected to nearly double again in the next 40-odd years. And this will be true for many pollen-producing plants. So that was a rapid-fire coverage of the way in which air quality may change and will change probably in many ways in different environments. So in summary, air pollution, climate change, and health, they're all closely linked. And most efforts to mitigate climate change also have clearly significant air quality benefits and will help improve health. And I'd like to just finish by just reminding you of these two reports that are available. The one from The Lancet, Climate Change is the Biggest Global Health Threat of the 21st Century, and a joint report from the Academy of Medical Sciences and the Royal Society, A Healthy Future, Tackling Climate Change Mitigation and Human Health Together. So with that, I just want to finish by re-emphasizing how important this topic is. Last week, the WHO held its second health meeting, Global Conference on Air Pollution and Health in Colombia, and there really was a lot of countries coming forward and pledging accelerated action for clean air energy access, and climate change mitigation. And I just hope that those countries will stand by those pledges because, say, 7 million people dying prematurely across the world is just an incredibly difficult issue for our health systems to deal with. With that, thank you very much for your attention.
Great, thanks, Frank. I think we'll take some questions just now, if that's okay. You've been very brief. I'm curious whether or not you sit at this point in time in an optimistic or a pessimistic frame of mind, and the optimism might come from, for example, what is happening in China. I was in Hong Kong lecturing last summer, and it's very striking there that the air quality is better, and that's because the fog from Beijing is not drifting down the coast anymore. And you speak to people on the mainland, and the electrification is happening at such a fast rate that the air quality has dramatically improved. So does this give you hope, or do the other factors that you've mentioned make you pessimistic for where air quality goes in the next 5, 10, 20 years?
So I'm both hopeful and pessimistic at the same time. So you're correct in that there are major improvements in areas where there was terrible pollution before. But even in China, even though those blue skies that you saw in Hong Kong, the quality of air there is still not good enough to protect health. So it's still around 30 micrograms per meter cubed of PM2.5, which is far too high. World Health Organization guideline is 5 micrograms per meter cubed. So there's still a long way to go to get to that health threshold. I'm pessimistic, on the other hand, because we have, for example, in this country, we have very, very lax air quality standards. Whereas in Europe, because we had Brexit, and we're not part of their legislation anymore, they're moving towards WHO guidelines. They have a target for meeting it by 2030. We're nowhere near that. In America, they had made a decision last year to go from 12 to 9, which was really, really a positive move. Unfortunately, yesterday we had the rollback that's not going to happen now. So there is good things happening in the world, and there are bad things happening in the world. So,
a question here, please.
Frank, thank you very much. Can I just challenge you or get you to convince me a bit more around the 7 million excess deaths? Because it's not like you've got any pathology. It's not like counting up COVID deaths. So how is that modelled, and how certain is that data? Because it's touted around and sounds a huge number, but what's the science and how certain is that figure?
So as you know, there's only one person in the world that's got air pollution on their death certificate. But the issue is that whenever you compare air quality in one area, one country or one city, compared to another one which has got higher pollution, then the number of people developing these chronic conditions and dying earlier is higher. So there is a risk factor coefficient that's calculated on that, and then that is used to relate to the other areas across the world.
But do such scenarios really exist as cleanly as that? That you've got matchable cities with completely with air pollution levels at the extremes? I just don't see that as likely.
Well, they do exist. There are areas in Scandinavia, for example, where there is a very low air pollution index, whereas there's areas, of course, in Asia where it's very high.
Question right at the back next.
We're not saying that it's the only thing. It's a contributing factor. For example, development of dementia. The Lancet Commission suggests it's one of 12 factors which leads to the development of dementia. It's not the only one.
Thanks. Very, very interesting. I wonder if you can factor in the interaction with short-term weather rather than climate change. So we have a large, quite long high-pressure system over the UK at the moment, which is why we've got lovely weather. And with that comes a problem of very low wind, so we don't clear our pollution or our pollen, our ozone and so on, because it's not being blown away over the North Sea. So there's an interaction between the weather and these diseases that you've talked about. There's another one, and speaking as a stroke trialist, we don't get many patients in this weather. But when the pressure falls, and it's the falling pressure rather than the low pressure, we're going to get a lot of strokes, and they're building up at the moment because they're not happening. So I wonder whether you need to factor into your models the sort of concept of short-term weather as well as all the other things you talked about.
So we've got to differentiate the difference between these short-term effects, which leads to asthma exacerbations, for example, and these long-term effects, which happen over decades. So that's what we're talking about. That's where the 7 million comes from. So an easy example to understand is around Guy Fawkes Night. When we have all the firework activity, then there's a big increase in people having to visit their GPs and hospital admissions. So when air pollution increases because of weather, because of maybe, we have an air pollution alert out at the moment in London because of the weather conditions. It's not because London's producing any more pollution itself, it's because that pollution is not being blown away from the city. So yes, these short-term weather impacts are very important.
We'll take a question in the middle and then at the front, please.
Yes, thanks very much. When you were talking about microparticulates, you don't distinguish between the different classes of this, and it's hard to believe, for example, that pollen would be as damaging as the products of combustion or stone dust or something like that. Have we really been able to distinguish between the pathogenic effects of these different sorts of microparticulate?
So when pollen is in the presence of certain pollutants, for example, ozone, then the protein coat is known to change, and you get some fragmentation of it, and the particles are smaller, so they can go further into the lung, and that's where you're seeing more respiratory effects because of that. There's an awful lot more science to be done. I wouldn't put pollen in the same area as I would put diesel exhaust, for example. But it is, the idea is that under this increasing climate change, there's going to be more of it, and it's going to be smaller, and it's going to be more reactive. But it's not going to drive the sort of issues that we see with combustion particles such as diesel.
Questions down the front, please. Well done.
Broadly, what's the shape of the dose-response curve for mortality?
It's a parabola, so it's short, it's slight to begin with, and then as you move up the concentration scale, then it gets steeper and steeper.
And it doesn't hit a plateau?
It has not been found to hit a plateau yet, no.
Okay.
So, Frank, thank you very much for that nice view. We have just heard earlier this morning that the smoking-related index that Sahao Zhao developed distinguished people not by their Townsend deprivation index, but instead by, I think, sheltered and temporary accommodation. And it just got me thinking, is there a way that we could put people in their temporary and sheltered homes somewhere that was healthier for them by air quality to try and overcome some of the other insults that they're having to their health because of their situation? And is there any evidence that that's something that could be done rather than trying to change the entire climate? Are there ways that we could take the people who are most at risk and put them in better quality air?
So that's a whole new issue. So you're talking about the indoor air that we breathe, 90% of the time we're indoors. And yes, there's now pretty good evidence that if you have a home which is heated and you cook with gas, for example, you're going to experience a lot more nitrogen dioxide and particles when you're cooking. If you're using lots of chemicals in that home, you will also have more of that type of pollution. And if that home is beside a busy road and the fabric of the home is poor quality, then there's going to be ingress of outdoor pollutants. So the simple answer would be yes, depending on the situation and the conditions of the individuals. And the other thing I'm thinking about is with the wildfires that we're seeing more regularly in areas in Canada, what they're actually doing now is setting up safe areas, safe houses in the town that people can go to, which are much better protected and have air purification in them for that period of exposure. So yes, I would agree with that.
One more question here, please.
Thank you very much for a great talk. Question we're always asked is, do face masks actually have any evidence that they benefit us?
Thank you for that. So, simple face masks, no. But if you're a cyclist and you buy yourself an expensive face mask, which is really tight fitting, well fitting, then yes, that will reduce your exposure to particles considerably. And also those masks have carbon filters within them, which will take out the gases like nitrogen dioxide as well. So it depends on the quality of the face mask.
Last question at the front here, please.
Thank you. Is there any good evidence showing like the causal like associations between climate change or like antiviral drug or biotics or antibiotic resistance or vaccine efficacy or something like that?
With climate change, I'm afraid I don't know. Sorry.
Great. Well, thank you, Frank. Short talk, lots of time for many questions, lots more discussion. We can maybe pick some of this up at the end. Thank you very much.